Improved welfare for medical doctors and provision of modern equipment in hospitals is the only way to save Nigeria's health sector from imminent collapse. That was the thrust of speakers at a dialogue for political parties and governorship candidates on their agenda for the health sector. Theophilus Darufai has details.
Poor remuneration, lack of job satisfaction, and security threats are among reasons Nigerian medical doctors are leaving the country to other developed nations to practice. This trend has negatively affected the country's health sector. At this event attended by leaders of political parties and governorship candidates in Zamfara State, this is the center of discourse. They are here to roll out their blueprint in revamping the early health sector and ways that will tackle the issues of brain drain in Nigeria and Zamfara State in particular. The dialogue session for political parties and governorship candidates on health sector agenda is organized by the Nigerian Medical Association Zamfara State branch as part of activities marking this year's Physicians Week. Chairman of the association, Dr. Sanusi Bello, is represented by his vice. He says it is high time to change the narrative from brain drain to brain circulation, considering the high number of Nigerian doctors leaving the shores of the country to practice abroad.
We also have issues of emerging and emerging diseases. Every time you hear a new disease that was not known in the last century coming up, and it comes with its challenges, and we are not ready to face those challenges. So that's why we invited the different political contestants, gubernatorial contestants, so as to avail them the opportunity to tell us what they have for the masses in our state.
The governorship candidates and their political parties release out their agenda for the health sector.
First, we need to do is to declare state of emergency on health. I'll take a case study of my own village in Nasara, where I mostly reside. And that hospital was built in the mid-70s. Up till now, no any additional block of anything that has been put in place.
I remember some few years back, there was 0 releases for malaria from the state. The government has relied on partners to provide for malaria. No, that trend must be changed.
The administration of the Controller will ensure that 15% allocation for health sector is actually met, as I said, not only through revenue, through allocation from the federal, but through revamping of internally generated revenue.
Other speakers at the event appealed to relevant authorities to give more attention to the health sector by improving doctors' welfare package and providing modern equipment. Theophilus Darufai, TVC News, Gusau.